you? Nice to meet you.
Nice to meet
I'm
you.
Dr. Shreya. How are you today? How'd you get here?
I got here fine. I'm feeling okay today.
That's good, that's good. What can I help you with today?
So, well, I've been struggling a lot with my smoking habits, especially since my asthma symptoms have been getting a lot worse.
I understand. Asthma and smoking can be a tough combination to deal with. Would you be willing to discuss some strategies for how we can manage this?
Yeah, sounds good to me.
Perfect. So can you tell me more about your smoking habits and how they've affected your asthma so far?
Sure, so I've been smoking for about 15 years now, around 15 cigarettes a day. My asthma symptoms have been worse recently, especially after smoking, but I just can't seem to quit.
I see. It is hard to quit smoking, especially when you've been doing it for quite a few years, and trying certainly does require a lot of motivation. It's great, first of all, that you do recognize the link between smoking and the worsening of your asthma, because it is the first step. How do you personally feel about quitting smoking?
So I definitely want to quit, especially for the sake of my family, but it's getting really frustrating that I've just tried so many times and failed.
You have tried, which is what matters. So quitting is challenging, of course, but I understand. Let's start by working on understanding your triggers first. So when do you usually feel like you're most tempted to smoke?
So I usually smoke right after meals, particularly after dinner, and that's when I'm most stressed. And those are the hardest times that I can't resist the urge.
So you said that you mainly smoke right after dinner. Okay, so let's break it down further. So after your meals, what usually happens?
I usually go outside by myself and have a smoke while my husband watches after the kids. This has become quite a bit of a routine for me, and he doesn't really seem too happy about it and really wants me to change this.
Okay, well, it seems to me that your husband is super supportive, which is great to see. Now that we've identified your triggers, let's try implement some sustainable strategies that we can use.
Yeah, that sounds promising.
Perfect. So based on everything we've discussed so far, on a scale of 1 to 10, how ready do you think you are to commit to a plan that targets your concerns?
Currently around a 9, as I really want to be healthy for my family and for myself.
That's fantastic. So we'll start with some small achievable goals first. What are some activities that you enjoy doing or have enjoyed doing in your free time?
I really like being in nature, and I used to have a small vegetable garden growing up, so maybe I could actually start getting into that again as a method to kind of distract myself from the craving.
Yeah, that's a great idea. Some more ideas are going for a short walk after dinner, or even having some downtime with your kids. That way you can relax and de-stress, and you can also minimize the urge to have a cigarette. But more importantly, you'll also feel fulfilled by spending time with your family.
Yeah, I can definitely give that a go.
Perfect. We can go through some relaxation techniques together, such as deep breathing or even mindfulness exercises. These can help you manage your stress without having to rely on cigarettes. Does this sound good?
Yeah, okay, great. That sounds like that'll help.
Perfect. So let's set some goals that you can work towards over the next few weeks. So we know that we want to aim to reduce the number of cigarettes that you use each day by focusing on the strategies that we discussed instead. If by chance you do feel the urge to smoke, how would you feel about noting it down in a journal or even on your phone?
I feel like that would definitely really help me keep on track, and my husband could also help me stay accountable for that.
That does sound great. I'm really glad you're willing to start this change first of all. Remember, I am here to support you through everything. Please let me know if you have any further questions. To wrap up, I will schedule an appointment with Dr. Stephen, who will check in on your progress in around a month's time. How does this plan sound to you?
Yeah, that plan sounds great. Thank you so much for your help.
Yeah, it's my pleasure.
Hi Nina, I'm Dr. Stephen. How are you doing today?
I'm doing good today.
That's great. Dr. Shreya mentioned that you've been working on quitting smoking and managing your asthma. Are you still keen on following up on that today and working towards your same goals?
Yeah, that sounds great. And yeah, I'm still keen on working towards my goals.
Alright, so just to recap, the plan that you and Dr. Shreya discussed, it involves engaging in forms of activity like walking, gardening and spending more time with your kids. You also looked at some relaxation techniques, including deep breathing. What do you think has worked for you so far?
Well, it's definitely been challenging, but I have managed to reduce my cigarette intake, which is good. I feel like the relaxation techniques are also helping with my stress, and I've also enjoyed getting back into gardening.
That's honestly great to hear. You should be proud of yourself for making an effort. Can you tell me more about any difficulties you faced and how your asthma symptoms have been since?
Well, the cravings are still a little strong, I won't lie, especially after meals, but they're not as strong as they used to be in the past, and I'm managing them better. But I am feeling a lot less stressed as well, which is good.
That's wonderful. It really sounds like you're making some positive progress. We'll continue with your current plan and try our best to maintain this, and I'll pass it on to Dr. Shreya as well. Going forward, how about you try implementing the relaxation techniques we discussed and the activities as well? Try aim for around 3 to 4 times a week. Does this sound reasonable to you?
Yeah, that sounds great. Thank you so much for your support.
No worries.